Hello, good afternoon, and a very warm welcome to you. Thank you for joining us today at this webinar, which is organized by the British Association of Social Workers in conjunction with the National Institute for Health Research. The webinar is about using best evidence in social work and social care practice with people with learning disability. My name is Dr. Godfrey Burhen, and I am a qualified social worker, and my PhD research was also in integrated learning disability services. So as well as having a great pleasure in being the moderator for the webinar, I will also offer some thoughts and reflections on how the issues that we'll discuss in the webinar this afternoon, how social workers can use those and implement the research findings in their practice. But I'd like to start by providing some context to the webinar. So on Sunday, the Prime Minister Boris Johnson signaled an important policy shift around the lockdown. So in his speech, Boris Johnson signaled that we're moving from the sort of immediate concern with the immediate crisis around COVID-19 to trying to return to some sort of normality, although we don't know what that normal would look like. But for social workers working with adults with learning disability, this sort of policy shift to normality just draws our attention to go back to think about the evidence that we know about what's effective for working with adults with learning disabilities. So it pushes us to think about what is the evidence about practice that enables adults with learning disability to stay well in the community and remain safe? How can we prevent the development of behaviors that may be difficult to manage? And how do we do this in partnership with adults with learning disability? So I'm delighted that we'll be exploring these issues in this webinar. What I should say is that this webinar is around some research which has been funded by the National Institute for Health Research. And these have been summarized into a useful document which can act as one-stop shop for social workers around best evidence that they can use in their practice. And in this webinar, we'll be discussing some of that research and thinking about how that evidence generated by the research can be used in practice. So we'll start with a presentation by Alison Ford and Tara Lamont, and they will explain the work of the National Institute for Health Research in funding research that generates evidence for social work. Then they'll be followed by Professor Wallace, who will talk about some of the research that I've already mentioned around some key thematic areas for social work practice. And Professor Wallace will explain some of the research findings on safeguarding, keeping people well in the community, and managing behavior that challenges. After that presentation, I will also offer some reflections from my own understanding and experience of social work practice, and also my own research experience. I'll offer some reflections on how we can use these research findings in practice. But before I hand over to Tara, I'd like to highlight two important contexts. One is that this is the second webinar which has been organized by the BASWA Special Interest Group on Autism and Learning Disability. This is our second webinar in May. In BASWA, special interest groups are led by BASWA members who have particular interest in specific areas of practice. And what they do is they promote the use of best evidence in practice. They also support research. They seek to influence policy. And importantly, they also seek to advance the interests of people who use services. So if you're interested in joining a special interest group in BASWA, please contact me after this webinar. A second context that I want to highlight is that Between 2018 and 2019, the Department of Health and Social Care commissioned BASWA to develop two practice frameworks, one on learning disability and the other on social work practice with autistic adults. Both of these practice frameworks were co-produced with people with lived experience. And importantly, they highlight the centrality of relationship-based practice, human rights, and for our purposes today, the need for social workers to draw on best available evidence in their work with people with lived experience. So I believe that even whilst we've had to do things a little bit differently as a result of the COVID-19 emergency, the three issues that I've just mentioned, the use of best evidence, relationship-based practice, and also the involvement with people with lived experience. These are core and timeless embodiments of social work practice, and we'll address some of these issues today. So we'd really like to hear from you during the webinar, and we'd like to include your voice in the discussion. So ask us questions, share your comments, and dare I say it, even challenge some of the ideas from our panelists. Use the question and answer panel on the right-hand side of your screen to send us some questions that you'd like us to address in the course of the webinar. And we'll also really encourage you to tweet your thoughts about the webinar as we speak. So once again, thank you for joining us. And I want to hand over to Tara to start her presentation on the NIHR funding of social care research. So over to you, Tara. Thank you.
Thank you. So I'm Tara Lamont from the National Institute for Health Research. I just wanted to tell you a little bit about the scope of the NIHR, what it funds that you may be interested in as both a user of evidence and perhaps as someone who'd be interested in doing some research. So the NIHR, which was set up in 2006, has a budget of around £1 billion a year. So it's actually the largest government funder of health and care research, of which over around £30 million is spent on social care research. And the focus is largely on adult social care because of how the budget lines run. And the spend on social care research is largely through the School of Social Care Research, which is a network federation of around 8 academic centres. And you may have seen some of the outputs from those units. So they include big studies on personal budgets, on safeguarding, on offender well-being, social isolation of the elderly, and kind of wider social determinants of health. So really worth browsing the NIHR portfolio to see research studies which are of kind of broader interest to you. As well as funding particular projects and units, the NIHR also funds people and is particularly keen to build capacity in social work and social care research, recognising it as an important area which perhaps has received less investment in the past. So there's around £2 million a year for training social care researchers, and that ranges from MSc dissertations to funded PhDs to postdoctoral and other substantive grants and fellowships. And that's all through a bit of the NIHR called the NIHR Academy. And as well as just funding good ideas or good kind of projects, PhD projects or whatever that come up, the NIHR also commissions research in areas that it has identified as priorities, and there is a whole process engaging stakeholders, engaging practitioners, people with lived experience to help identify what are the pressing uncertainties where we need further research. So, for instance, there's a call out at the minute for new research on family group conferencing, including the appropriateness of that for people with learning disabilities. So keep an eye out for opportunities for new research if you are research active yourself. But it's also perhaps interesting for you to know that NIHR is very much needs-led, so it will try and actively commission research in areas that the service has said is important. So before we just get on to the findings of the review on NIHR funded research around learning disabilities, and thinking perhaps about the opportunities for new research, the review did pick up some areas where there were gaps, where we didn't know enough from the evidence that's already out there. So I think the NIHR would welcome new applications and would particularly perhaps welcome high quality research in those areas in the report that were identified as gaps. And those include broadly research in non-institutional settings, research in the community, so in group homes and residential care, but also particularly thinking about health and well-being and sort of maintaining healthy lifestyles. There's a particular shortage really of high quality evaluations of tailored interventions to promote weight loss and promoting physical activity and so on for people with learning disabilities. I'll now hand over to my colleague, Alison Ford.
Thank you, Tara. So I really just wanted to expand a little bit on the question of the reach of this kind of evidence. Tara's spoken about the importance for NIHR as a big public funder of research to be asking the pertinent research questions that relate to practice and to get that research done to the best quality and to publish it. In the last few years, NIHR has really invested a great deal more time and effort in that question of disseminating the evidence, enabling people such as yourselves to be aware of the evidence that's emerging from funded research and reaching professional and service user audiences with reports like this themed review that we're talking about today, which bring together studies on specific themes. And for this particular review, we were particularly fortunate to have an excellent expert steering group, which really helped us to ensure that we both scoped the studies correctly, we created the right narrative, and we put that together in such a way that you yourselves and service users, carers, professionals of all types that work with learning disability services could make use of the evidence. So on that group, we had academics, practitioners, third sector organisations, we had professional bodies. And we also had, particularly important to us, to have the input of people with learning disability and of their carers from outreach groups. And that formed the starting point, really, for raising awareness of this review and the significance of the evidence that it summarises. So, as with all of these types of reports, we've worked on a detailed plan to ensure that this range of people are aware of the evidence and its significance. For example, through press briefings, through conferences, workshops, and the sort of usual email cascades and the use of social media that you might expect. And that will continue for some time. And it's been made easier as well in this particular instance because we've also, in addition to the full report, we've provided an easy read summary, which means that it is more feasible for people with learning disabilities themselves to have access to a summary of the evidence. And part of our communication process is starting that reach with a launch event. So I'd just like to show you a very short film, which is a little montage of a launch event that we ran in February of this year in order to make this review well known to our audiences and to be able to have some discussion about the very principles that we're talking about today of how people can take the questions that the review poses and really work on how they can take those forward into their own individual professional practice, and how users of services can also be aware of those issues too. So what you'll see in the film is a brief montage of the launch event that we ran.
Thank you all very much for being here at Mary Ward House today. It's a great pleasure to see everybody here for the launch of this themed review on learning disability health and care services.
This review is really important to me as a social worker. Social work with adults with learning disability, there's a research gap in terms of what people's needs are, crucially in terms of what we can do to make people's lives better. I think instinctively as social workers we know what we need to do, but that's quite different from actually having research evidence about what's effective.
Bringing together NIHR research relevant to learning disability services.
For me, the two main threads that I found really important. So one was a cluster of studies around the importance of annual health checks by GPs, picking up problems that might particularly affect people with a learning disability like thyroid problems, but also picking up common health problems that are perhaps underdiagnosed. The second thread, which is more sort of mixed but really important, is around what we know on person-centred support, positive behavioural support in particular, in helping manage behaviour which challenges.
We have had decades of learning disability related research, and to be honest there's been very little change in the lives that people are leading, and so I think for the NIHR to pull this NIHR funded research together to explore what we know, what this research has told us, and also what gaps remain is hugely important.
I think this is exactly the kind of thing that is required. It delivers the kind of evidence that clinicians and policymakers and the third sector can use in designing services and delivering interventions to improve the health and mental health of people with learning disabilities.
Now is just go round each of the tables and ask for the headline takeaway piece from each table, if that's okay.
We also had a discussion about the difference in evaluations of positive behaviours.
Certainly the health checks kind of caught the imagination of many of the people around the table, as well as the issues of implementation. So in terms of why you might find different results in one study compared to another.
Well, in my case, because I'm partially sighted, I'd like stuff made in big print so I could understand it.
And talk to us rather than our carers.
I think the review was really useful, the reflection points at the end of each section, to sort of raise questions to think about, and also to sort of like try and work out where should our research efforts go. I think it's such a useful exercise. Instead of just having this broad whole facing the learning disability research arena, we now have focused questions to think about and work with people to produce good funding applications.
Thank you very much for that, Alison. I mean, as a social worker with experience of working with adults with learning disability, what really struck me was the range of professionals who have been involved in the production of the theme review. I was really also heartened by the fact that people with lived experience have also been involved in the production of the theme review. And also, the review just drew attention to issues around health inequality. You know, the fact that we know that as social workers, people with learning disability are less likely to have access to good quality healthcare, and the various issues that come into the delivery of this healthcare. And I'm pleased that these have been explored and explained in the theme review. And I'm really pleased to see that Louise is ready to talk to us a bit more about the research findings and some of these issues that I've just mentioned and what were also shown in the video. So Louise, over to you.
Thank you very much. Can we have the next slide, please? Better Health and Care for All features 23 recent studies with important findings for those who commission, deliver, and work in these services. These range from qualitative research on user experience to randomized trials of complex new services. Many of these studies involve people with learning disabilities and family carers in the research and in delivering the interventions. People with learning disabilities and family carers, practitioners, managers and commissioners have contributed at each stage of this review. Can I have the next slide, please? The report is important because there have been 3 decades of government policy seeking to improve services. Much is known about what does not work, but there's a lot less evidence about what works well. Guidance such as that from NICE highlights that policy changes are often made without underpinning research evidence because there are few high-quality studies. And we're going to present to you some of the best studies that have been funded by NIHR in this area. Next slide, please. The report is important for social work practice for particular reasons. We know that people with learning disabilities die around 20 years earlier than others, often of preventable disorders, such as type 2 diabetes, and manageable conditions such as epilepsy and swallowing problems. Comorbidities are often overlooked, and illnesses such as cancers undetected because of diagnostic overshadowing. So the label of learning disability means that inquiry goes no further. People with learning disabilities experience many inequalities, not just in health, but social care, as well as education, employment, justice, civic participation, which are all fundamental to human rights. Those whose behaviour challenges are often over-medicated and activities restricted. Decades of government policy has aimed to improve these public services for people with learning disabilities. Next slide, please. Following numerous scandals and inquiries in all parts of the UK, these policies have been developed and are ongoing, including the Learning Disability Mortality Review or LEDA audits in England, which continue to find great variation in service delivery and practice. Reports from the beginning of this century, valuing people now, building the right support, and the long-term NHS plan enshrine principles to personalise services to enable people to live full and independent lives within their communities and reduce inpatient beds. Service integration across health and social care. Mechanisms have been put in place for years, such as the pooling of budgets and personal budgets, but we know that austerity has reduced provision. The NHS long-term plan supports these principles and does set out some new aspirations. The next slide, please. One of these is that health checks for those aged 14 years and over should increase from half of those registered in GP practices to 75% of them in this year. Healthy lifestyle services, such as those for weight reduction, for improving exercise, These service providers should make reasonable adjustments, and services should give active support or adapt their services for people with learning disabilities. Healthcare services should identify people, for example, in the medical records with digital flags, so that staff are aware that they're about to be serving somebody with a learning disability, and then help them and their family make adjustments to the care that they're going to provide. Personalised care for all, including those with very complex needs and behaviour that challenges, remains an important priority. Next slide, please. So turning now to the review. First of all, 3 large studies looked at learning disability health checks and found more learning disability health checks are being recorded by GPs when they are incentivised, and they pick up more preventable disorders, but they are onerous to do. GPs find that it takes them longer than their ordinary consultations. Health checks do pick up conditions such as diabetes and epilepsy, as they do in the general health check, but also for this client group, they pick up thyroid and gut disorders, which can be more frequent in this population. Those not checked will go on to have more unplanned care use, in other words, emergency hospital admissions, while those having checks used more planned services. So it looks like health checks do help create more preventive services. Health checks reduce preventable admissions, but they also found, curiously, that in general, the consultations between GPs and those with learning disabilities are shorter than for the general population. As a result of these studies, we recommend that more can be done to increase health checks, do health checks well, and link them to health action plans. Next slide, please. 13 studies, many of them quite small, looked at how people with learning disabilities can keep well in the community. They found, for example, that adapted individual and group programs for weight management and diabetes, such as Shape Up, are feasible, but we would need larger studies for us to know that they are actually effective. An important study looking at survivors of violent relationships found that women who have suffered violent relationships experience inadequate help before and after the abuse. In a large survey of police officers and healthcare practitioners, and those from social care, they found strong agreement on why women with learning disabilities may be in violent relationships, such as being seen as an easy target, socially isolated, coming from a difficult family background. Few of these staff felt their training covered the essential methods of communication and skill for working with people with learning disabilities. The study recommended alerting women to the known profiles of risky men, supporting self-advocacy, and improving the training and working practices between police and social workers, which could make a difference. In a different study, they found that mothers and fathers with learning disabilities experience inadequate adjustments of maternity and parenting parenting services, often feeling that they're on the defensive of trying to retain control over their child and prevent it being taken into care, rather than it being seen to be a supportive effort. Services such as for depression management work well, we know, with the general population using techniques from cognitive behaviour therapy. Studies have looked at how to adapt it for people with learning disabilities, the Beat It and the Step Up programs. And these have found to be certainly acceptable. Again, larger studies are needed to know how effective they are in the longer term. Next slide, please. Three studies were conducted in general hospitals and looked at how well these services care for people with learning disabilities. They found there's great variation in how well the general hospitals meet the standards of adjustment for patients with learning disabilities, especially the extent that staff are trained and involve families in the patient's care. Specialist learning disability nurses do make a difference, but their reach within a hospital can often be quite limited. Readmission to a general hospital within 30 days of having been discharged is an important patient safety standard, and it was found to be higher in people with learning disabilities than for other adults. And they were readmitted for preventable conditions not picked up in hospital. So it looks like the care in hospital is not always meeting their needs. Systems for medical record flagging now exist in most hospitals. However, at the time of the study, only 13% of staff were using the flag to make any difference to the care provided. Next slide, please. Some people with learning disabilities show behaviour that challenges others, and when they do, there are often poor health and social care outcomes for them and greater cost to services. There were 5 studies that looked at positive behavioural support. One of the studies was developed for community learning disability staff, and unfortunately, it did not show that it was effective, but it's possible that this study produced an inadequate training intervention and staff were not adequately supervised in how they applied it. In another study, in residential care, staff welcomed a co-produced training programme where people with learning disability acted as co-trainers for positive behavioural support. It did improve staff morale, but no effect was shown on residents' behaviour. In another study that simply observed the levels of support for people in residential care with learning disabilities, they found very large amounts of the day these people were not interacting with anybody. And those who were interacting tended to be those who were already the most independent. I'd like to give you a little bit more information about one of the studies which produced some really quite intriguing results. This was a study in the homes managed by Dimensions. They intended to find out if changing staff practice using positive behavioural support and quality improvement methods would make a difference. The study was a randomised controlled trial in 24 homes, so they could see the effect of the training versus not having that training. An expert practitioner researcher observed practice and worked with the care home staff over a period of 8 to 11 months to develop a programme of change. Once they had conducted observation, feedback was given on how well the home was meeting the agreed 8 key areas of social care practice that support behaviour change, and they developed an improvement plan. Taking this system-wide approach, they met with staff and managers and were involved in problem solving, coaching and training them. There was a significant improvement in staff-rated behaviour that challenges of the residents after the interventions. Indeed, it reduced by as much as 2/3, and very little change occurred in the other homes that didn't have this intervention. Much of this was maintained 18 months later, and the staff rated this intervention to be really positive and improved their working morale as well. Dimensions reported at our launch event on how well they'd continued to develop this successful approach. Although the intervention was intensive for staff, and it could therefore be costly, the extent of change achieved, they believe, could reduce costs to services in the future. Next slide, please. NIHR has a strong record of funding studies that involve the public, patients and service users in the research process. Many of the studies involved in this review included people with learning disabilities and carers in the research, including some with profound communication problems, delivering some of the interventions to staff. The review shows that high quality studies are feasible on, with and by people with learning disabilities. As participants, the research had included some of the most vulnerable populations where ethical issues of consent require careful navigation. The co-production and delivery of services with people with learning disabilities are welcomed. Many of the studies in the review show how to do this well, such as a current study, which is with and by people who use communication aids routinely. Next slide, please. The report can be downloaded in the full and an easy read version. There are also short videos about the study, and there's an interview with me as the author of the report by our lived experience experts. Can I have the next slide, please? As Tara has said, NIHR funds individual researchers and projects, and these are the links you can use to find out more about them. And you can also make a link, take the link to what we call the portfolio, which is a library of the full reports that have been of completed studies of the NIHR going back several years. And that's the link at the bottom. Thank you very much indeed.
Grace, thank you so much for that really interesting and thought-provoking presentation. I say thought-provoking for our social workers because they just identify so many issues that can be used for reflection on practice and thinking about how we can do things better and how we can do things differently as social workers. And as I said, I'll offer some thoughts and reflections on the themes that you've identified in your presentation. But before I do that, we're getting a number of interesting questions from the audience that I wanted us to address at this time. One is about the conduct of the theme review, so selecting the research, the studies that have been included in the theme review. And it's a question, this may not have come up in the work on the theme review, but I wonder whether you had any thoughts on this around whether you identified any studies on learning disability and criminal justice in the review. But there's a wider issue then around how some of the studies that you've just spoken about were identified for the themed review, and also the processes around the conduct of the theme review. So just wondered if any of you might have some thoughts on that.
Okay, I'm happy to do that. Sorry about that.
I'll start with Louise first.
Thank you. In the review, we set some inclusion criteria, and we decided it would be the health service and social care services specifically. So we excluded the criminal justice system, but there are studies in the portfolio which do look at people with learning disabilities in the prison system, which you'd need to look at on the journal's library link.
Fantastic, thanks. And I've got a question about that shortly, but I'll just go to Tara because I know you had some thoughts on the earlier question.
Yeah, in fact, just to add to what Louise said, so although from my knowledge, I don't know that there are specific studies around learning disability. There are kind of general offender health studies, and there's an offender health research network hosted at Manchester, which has carried out a lot of NIHR studies on a number of topics. And there are also studies in the NIHR portfolio, for instance, on street triage, on collaborations between particularly mental health, social work and police officers in identifying sort of vulnerable people who with mental health problems and places of safety and so on. So I think there's lots of relevant studies, but they may be a bit buried. They may not have learning disability tagged in the title.
Okay, fantastic. Just before I ask you the more general question about how the theme review itself was conducted, for you all to say something about it, I want to highlight that the material from this webinar would be on the Basel website, and so we can, when we put that on the website, we can include some references to how studies on criminal justice and that you've just mentioned, Tara, can be can be identified. Can you say something then more generally about how the themed review was conducted, how studies were identified, for instance, and the involvement of practitioners in the conduct of the theme review? I ask this because I know that in the work you've ensured that the research is as relevant to practice as possible. So I just wondered whether you had any thoughts on that. Starting with Louise.
Okay, so for this review, as has been done for other reviews of the centre, there's an advisory group set up, which is by invitation to key people from the different potential stakeholders of the area of practice. And this included yourself and also others from social care and also from a number of different parts of the health service. As well as the constituent groups that have a long-term interest in learning disabilities, such as Learning Disability England, and some of the other bigger third sector lobby groups and providers. We did include also members of people from the provider organisations. Again, we had contact with Dimensions and some of the other bigger providers in the field. In addition to them, there were practitioners that came from the main sort of professional bodies, not simply social work, but for example, clinical psychology, psychiatry, general practice. And we had input from organisations that Alison had referred to, which we call the outreach groups, but which were particular groups where we commissioned them to provide us with feedback at absolutely key stages of the review, right from the beginning of the scope of the review. So people with learning disability through the self-advocacy groups that we were working with came up with what they felt would be important questions and some of the defining factors as to what would and wouldn't be in the review. And as we went through the review, I think we had 3 possible ways in which the advisory group was involved at 3 different stages. They were able to help to give us advice as to what would be important to keep in and to keep out, and also, importantly, how to make the outputs practical, because this isn't aimed at researchers as such, it's aimed at people who are going to use the research. And so we wanted to make it as actionable and practical as possible. So when you look at the review itself, you'll find that there are a number of ways we've tried to make the physical layout of the review reflect that, with recommendations, with case studies, which are real case studies, which came from our user groups, with their reflections on the issue, and also with pointers or action points or points that can be taken back into practice as a result of reading about the studies. So that's how we've tried to involve all those different constituencies throughout the report.
Thank you very much. Alison, did you have some thoughts on that, the conduct of the review itself? I think you're mute. Are you mute? Alison, can you hear us? Right, we can't hear Alison, but I'll go on to Tara in the hope that by the time I return to Alison, we've sorted out our IT, the connection. Tara, any thoughts on what Louise said?
I think the only thing I'd add is that although in some ways our primary audience was people involved in actually kind of delivering services for people with learning disabilities. And that could, as Louise said, range from social workers to speech and language therapists and learning disability liaison nurses and so on. So in a sense, those specialists. But we also wanted to reach kind of mainstream health and care services. And in a way, that's more important, to raise awareness of the issues for people with learning disabilities on, in hospitals, say, on general wards, in the community, sort of general social workers or mental health staff or whoever. So we weren't just thinking really about people whose main job was working with people with learning disabilities, but about raising some of these important issues for mainstream services and staff.
Okay, fantastic. Thanks very much. We have a number of questions that I want to put to the panel, but just before we get to that, let me just offer one or two reflections on how some of the points discussed by Louise can be used by social workers in practice, and just think about the important social work issues which are apparent but perhaps need to be drawn out to make them a bit more explicit. The one important lesson for me reading the review is how we identify the extent of health inequalities and health discrimination for people with learning disability. And as a practicing social worker, sometimes it's not always been apparent to us that actually health and access to health care should be a key concern for us social workers. But the theme review is important around health. It's important for another reason. It identifies really practical ways that social workers can ensure that access to healthcare is improved and also increased. And colleagues, social workers listening to us would know this. It just highlights the importance of using our interagency working skills, working closely with our colleagues in the health sectors, and importantly, also seeing ourselves as advocates for health care of adults with learning disability. So that on health, that was my first reflection. The second reflection that I wanted to identify was around keeping people well in the community. And I was really struck by some of the findings around domestic abuse of people with adults with learning disability. But our listeners who are social workers and social care professionals perhaps will agree with me that working around domestic abuse presents particular challenges to social workers, because we're dealing here with the fluidity and the quite complex ethical issue around mental capacity. So how do you move between assessing that someone has mental capacity to maintain that relationship and moving on from there to actually, we need to intervene in your own best interest? But reflecting further on some of those studies, the one thing that occurred to me is, again, going back to models of relationship-based practice, which really emphasize long-term sustained engagement with people experiencing domestic abuse, because it's in this way that we can do that sort of therapeutic work involved in getting people to change and leave abusive relationships. But overall, I think the studies really highlight the importance of co-production and involvement of people with learning disability in research and also services design and also care planning. So those are my just quick reflection on this, and I'll be interested in what our our audience also say about the how we can use those reflections, those studies in social work practice. But I just want to return to some questions from the audience now. Can I just ask, Alison, just a question about research dissemination? You mentioned in your presentation the efforts that the NIHR are making to ensure that the research reaches a social care audience. But can you tell us a bit more about this, how we can ensure that this theme review especially reaches a social care audience as wide as possible?
Absolutely. And, you know, just to reiterate, as Louise pointed out, it's very easy to share this report by sending the link from the NIHR evidence website to colleagues, to families or individuals that you may be working with, both the full report and the easy read summary. And that report is downloadable in its principle. And if we ever get back to normal office working, we'll also be able to send people copies of the print versions of the reports. So that would be great to be able to do that. So you can tell people it's there. But of course, the key issue is to highlight the questions and the issues, the threads that run through the report itself. And Louise has talked about the prompts for reflection that we've built into the review structure, and these might indeed in themselves pose very useful questions for you as an individual practitioner to use as a start point for discussion. We know from previous experience, people have told us this, that they would use these sorts of themed reviews in a number of ways. For example, they might discuss the questions or the issues or the problem that is identified within the evidence analysis at a one-to-one meeting or a supervision meeting. They might raise those for discussion within team meetings or with individual clients, service users, carers, families, to actually examine whether a particular piece of evidence is true for a particular setting, and if so, what the local response to that might be. But often, of course, those are start points for much greater local guidance and policy change. The kind of issues that are picked up in the review can also be used for teaching sessions, for professional development. You might, for example, attach an extract from this review to another report submission that you're making or presentation, or make use of those in appendices to business cases, even in terms of the development or for investing in a particular intervention or change of practice. You will know best how you can use the evidence from these summaries to influence practice change. But it all starts with making that evidence and its significance known and understood by both yourselves, your colleagues, your managers, and those who plan and develop your services.
Fantastic, thanks very much. And just to add to that, Alison, having read the review, I was involved in the advisory group, so I have read it, but I think it really lends itself to supervision, either within a group and also actually as one-to-one with your manager. And I'm pleased that you identify that, because it's written in such a format that social workers can use it in their team meetings to discuss some of the research evidence and how it can be situated within practice. We're getting some more questions about the themed reviews and other themed reviews. But broadly, I think these refer to the relationship between the theme review that we've been discussing and also other guidance, such as the NICE guidelines and other practice frameworks. So I wonder whether, Tara, you had any thoughts on that? Can you hear us?
Yes, sorry. So, I mean, this review complements NICE guidelines, SKY guidelines, and so on. So I think it's, as Louisa said before, it's kind of broader. So it's not just the kind of must-dos and the sort of treatment or service questions. It includes, for instance, kind of qualitative studies on experience and quality of services and so on. So I think it's a kind of more general read, and I'm just sort of struck by just thinking of some of the other kind of questions that have come through, and thinking, you know, I suppose our limitations are that, you know, we have packaged up the evidence in an attractive way, but it reflects the evidence that is there, and there are gaps, as we've said before. But it does make me think that some of the questions coming up, for instance, around the kind of criminal justice system and issues of consent and care for people with kind of cognitive differences and things. There are very kind of relevant studies, again, not sort of badged up really as social work or as learning disability in the NIHR portfolio, but there are, I don't know, kind of studies around the Mental Health Act and near relatives and so on. And so there's probably some parallel evidence that's in the kind of broader NIHR portfolio. We kind of selected and interpreted evidence for a particular purpose here around learning disability services. But I would encourage people with particular interests, and other questions I think have come up around ethnicity and diversity. Yeah, I mean, there's probably a little bit, Louise might say more, but on, for instance, the diabetes prevention study that featured in this review, I think because it was set in the East Midlands, there was quite a focus on sort of South Asian people and those kind of tailored interventions. But I don't think that there was a main stream of studies around diversity and ethnicity in relation to people with learning disabilities. But I would encourage people who have particular interests to just do a sort of a broader search of the NIHR portfolio to find other studies of interest.
Okay, thank you very much. And just, yeah, Louise, did you have anything to add to that? The sort of the gaps around the needs of particular groups of people, say ethnic minorities and others?
Yes, there was one study in this review, but it's quite a small study in Birmingham, and it was about how commissioners can engage people from BAME LD backgrounds in the commissioning process, which was quite interesting. And I think it tended to show the things that you might expect around it is possible to include people in the process, and cultural practices, practitioners and commissioners can be at fault for having quite stereotyped views as to what cultural norms are. And in fact, individuals vary from their cultural background and have a diversity within their cultural backgrounds that should be taken account of. So I don't think the study would surprise you if you are aware of the sort of diversity of the population that are now being served in these services. It is true to say that there are relatively few studies that have made efforts to characterize the population in the study according to ethnicity. So quite often the problem is that they may well be there, but unless, for example, as Tara says, you know that the population is likely to have had a high BAME proportion, it's not so easy to find that as part of the research study, or that the research questions necessarily relate to it.
Thank you very much, Louise. And this is all the time that we have for our webinar today. I'd like to say thank you to our audience. This is the start of a conversation around the NIHR funding of social care research, and we encourage you all to get involved and also check the Basel website for the outputs of this webinar. On behalf of our speakers, I'd like to say thank you to my colleagues, Dr. Jane Shears and Steph Davis, who have put this webinar together. And thank you all again for joining us. Have a wonderful afternoon. My name is Godfrey Boyhin. Bye.